You're watching low back pain exercises for phase 3. So you've already completed phase 1 and phase 2. I want you to continue doing phase 1 and phase 2, especially the mobility and especially the exercises that we've prescribed you for phase 2. For phase 3, you're going to need the purple band for the stretches. So watch the 7 steps. You're going to repeat that. You're also going to need this for distraction. I'll show you that in just a second. You're also going to need the smaller resistance band as we're progressing with the other exercises. So we're going to start out why you need this besides doing 7 steps. So you're going to have your husband and your wife. They're going to put the band around themselves, okay? Then you're going to apply the band to the front of the hip. Go ahead and have yourself will pull the knee, and they're just going to lean back as the band is around their waist. It is actually going to distract the hip nicely. If you have an artificial hip, if you have degeneration in the hip, don't do this unless it just absolutely feels great, okay? So you're going to do it 10 times, and at the last one, she's going to hold it for 30 seconds. So go ahead and just pull that knee towards your chest. Pull the knee with your hands. Good. And you can just let your husband, wife, partner can lean back and distract that hip. From there, we can also do a different hip distraction. Go ahead and stand up. Face that way. And you're going to step through the band, step through it, and I'm going to put it right up against your hip, and go ahead and lunge forward with your right leg. And that distraction is going to help open up that psoas and hip stretch. All right, so from here, you're going to hold that for 30 seconds. So we targeted the psoas with the ball smash, and you're doing this already through phase 2. Now we're going to progress into what we call a couch stretch. So a couch stretch is you're going to go into that lunge position. So if you have a knee replacement, arthritis, hip issue, don't do this. You're going to drop the knee here, and I'm going to do this for demonstration, and you're going to drop straight down onto that pillow. And you're going to lean in, your arm's going to be straight above your head just like that. It's going to lengthen this whole entire chain. It's going to lengthen that psoas. If it hurts or you can't get down in this position, don't do it. But we want to do this couch stretch and progress forward. If it hurts doing the couch stretch, you can just go into a slight lunge, arm above your head, all the way lengthening this. Go ahead and go to your back for me. So after the hip distractions, you're done with the purple band. You're now going to go back to that march. So she's going to drop straight legs down, and she's going to go one leg up, opposite arm up, and as she's doing this, she's going to lower the leg down, but it's not going to touch the base. So her feet are staying elevated. This is engaging the core, it's engaging the quads, the glutes, and the low back. And she's going to do this march for 10. You're going to be able to do this for 3 sets of 10 as you progress. 10 week 1, 10 week 2, 10 more week 3. So 10, 20, 30. From here, she is going to go into a plank progression. Here's where you're going to watch the plank progression video that is attached to this. So go ahead and go into a plank position. Ultimately, I want you to end up in this position, but you'll watch the plank progression to see how to get into this position. And you're going to, glutes are tight, core's tight, erectors are tight, straight line, head neutral, all the way down. Hold it for 10 seconds, work up to a minute. From here, she's going to get on her hands and knees, and we're going to continue some of the exercises we did in phase 2. So hands and knees. We're going to do this hip extension, keeping this straight. This is the most important step. She's going to extend her left leg back. So extend it back, squeeze the glute, come back to neutral. Do it again. You're going to do 10 of these on each side on phase 2. Now with phase 3, she's going to extend the left hip and take the right arm up. And don't overextend it. Keep it neutral. Back down. And do it again. So you're going to alternate left hip, right arm, and then right hip, left arm. And don't overextend this. This should stay neutral. There should be no pain in this. She's on an unstable surface. It's very difficult for her to do, and she's doing excellent with it. From here, you need the yellow band. Go ahead and lay on your side. This is where we add the resistance band, and you get a yellow, green, and blue band when you get the bands from us. And this is for clams, fire hydrants, and also for the band walks. So actually switch back to where you were, but I'm going to put these over your knees. So the band needs to go right above the knee, okay? And if you can flatten it out, it's not going to dig into you as well. So go ahead and get on hands and knees. And we're going to do those fire hydrants like in phase 2, but we've added resistance. So go ahead and open that hip up. Very good. So ideally, as we progress, she's going to be able to get that hip all the way up just like that. Very good, without a huge amount of rotation in the hips. Got to keep it neutral. So you're going to do 10 on the left, 10 on the right, each week progressing 10, 20, 30. Our ideal goal is to be able to get you up to the green or blue band depending on your condition. So go ahead and lay on your right side for me. So knees are going to be bent. The band is above the knees. Feet are together. She's going to do the clam. So she's going to open all the way up, and she's keeping neutral spine. Core is engaged, and she's squeezing these glutes every time she does it. We're going to do 10, 20, then 30. Week 1, 10, week 2, 20, week 3, 30. If this band is too easy, and it looks like it's too easy for her, she's just killing it right here, we're going to go ahead and progress her to 20 repetitions and then 30 repetitions, quicker. Then she'll move up to the green band and then the blue band. So from here, she is then going to roll over to her back, so she doesn't have to take the band off yet. Let's go ahead and do your glute bridge, lift straight up. Now, what I'm going to have you do is straighten your left leg out. And now lower down, all the way down, and come back up. And she's going to do this march. Straighten the right leg out, back down. She's going to do 10 of these marches. After she's done 10 of these marches, she's then going to go into a unilateral glute bridge. So, very good. Go all the way down, straighten one leg out, lift yourself up with one leg. There should be no pain with this. She is using the right side to stabilize. Back down, and you're going to do 5 to 10 of these unilateral glute bridges. Go ahead. Perfect. And back down. So, switch sides. Straighten your right leg. Now come up. Perfect. 10 of those, 20, 30. Go ahead and stand up and face the camera for us. So you're going to keep the resistance band around your knees. So if you had trouble with those band walks before, you're just going to be progressing through these bands. So go ahead and we'll have her do the band walk again, and then we're going to show you how this phase progresses. So go ahead and knees apart, step 6 inches, keep your knees slightly bent, and 6 inches out and back to neutral. So this is much easier than using the long lever. Come back to neutral, and come back to right in front of the camera. And we're going to have you take that band off now. So you'll progress yellow, green, blue, and then ultimately we want to get you to the purple band for the band walks. So she's going to step on this, and this is phase 3, so we are going to exit this time, meaning we're going to cross it and create an X. So she's going to cross it. Go ahead and put your feet partially apart, and make sure there's not a lot of resistance between that. So there should be some slack in between the feet. Pull all the way up towards your chest and stabilize the elbows to the side so you don't hurt your shoulder. Step out 6 inches and come back to neutral. Keep your knees slightly bent. There you go. Perfect. This is activating the glutes. She is going to do 10, 20, and 30 progressions with the bands X'd, which is going to help stabilize the glutes, decrease the pain, and ultimately get you to where you want to be in health. This is phase 3, low back pain exercises.